Imagine human bones like weight-bearing elements in a building. In a way, bones are built like reinforced concrete pillars. Instead of steel, rebar, we have collagen fibers, and instead of concrete, we have calcium crystals. However, unlike concrete pillars, bones are living and surprisingly metabolically active tissue that constantly remodels itself. Normally, bone structure and mass are maintained over time. Sometimes, factors such as aging, hormonal changes, or various other reasons can disrupt this process, leading to a loss of bone mass. This happens quietly, without any pain or warning signs. Then one day, a hip may break when you trip, or vertebra might collapse when you sneeze. This is when you become aware that your bones weren't just aging. They become as fragile as glass. And what is glass known for? Shattering, of course. Hello and welcome to Medicine Simplified. Today I'd like to talk about osteoporosis, a silent, creeping condition that turns bones from tough concrete into a brittle glass. Osteoporosis can be defined as a reduced bone density, which increases the risk of fractures. It primarily affects postmenopausal women. However, men and premenopausal women with certain diseases or risk factors can also be affected. While it can lead to fractures in nearly all bones, vertebrae and hips are most commonly affected. Osteoporosis is associated with the loss of bone mass, which happened as a result of the bone remodeling process going wrong. Aging and various other internal and external factors can accelerate this process. Bone remodeling is a lifelong cycle that involves the gradual breakdown of old bone and creation of new bone. This cycle is maintained by two teams of cells. One is in charge of construction, and we call them osteoblasts. Others are in charge of demolition, and we call them osteoclasts. Osteoporosis happens when the demolition teams start working overtime and the construction team falls behind. Therefore, the formation of new bone does not keep pace with the breakdown of old bone. In young individuals, the rate of bone breakdown typically matches the rate of new bone formation, resulting in stable bone tissue. However, after the age of 45, bone breakdown typically starts to outpace new bone production, leading to a gradual loss of bone mass. This process accelerates after menopause. Even minor reduction in bone mass can significantly increase risk of fractures due to alterations in normal bone structure. Several chronic diseases are linked to an increased risk of osteoporosis. The mechanisms of bone loss can vary depending on the specific disease. Additionally, many commonly prescribed medications, particularly corticosteroids, can negatively affect bone health. However, conditions treated with these medications often also contribute to decreased bone density. Risk factors for osteoporosis can be divided into two categories: non-modifiable and modifiable. Non-modifiable risk factors include female gender, older age, smaller body size, and a family history of the disease. Modifiable risk factors encompass lifestyle choices such as smoking, lack of physical activity, and excessive alcohol consumption. Individuals who lead sedentary lifestyles, especially those who spend most of their time sitting, face a higher risk of osteoporosis. This is important to note that only weight-bearing physical activity stimulates bone regeneration. Long-term smoking has been observed to adversely affect bone density. This is likely because women who smoke tend to enter menopause 1 to 2 years earlier and are more susceptible to chronic diseases that negatively impact bone health. Additionally, consuming more than 2 alcoholic drinks per day also harms bone health. Osteoporosis initially does not cause noticeable problems. However, as the disease progresses, individuals may experience back pain, a hunched posture, and reduced height due to fractures and collapse of vertebrae. Collapse of several thoracic vertebrae leads to breathing difficulties and an increased risk of lung infections. Conversely, collapse in the lumbar spine may cause abdominal pain, bloating, and constipation. The collapse of vertebrae alters posture of the affected individual, disrupts their sense of balance, and creates fear of falling. This fear can result in avoiding open spaces and ultimately social isolation. In relatively younger women with preserved reflexes, forearm fractures from fall onto an outstretched arm are common. In older individuals with slower reflexes, hip fractures are more prevalent. The diagnosis of the osteoporosis starts with measuring bone density through a method called osteodensitometry, or DXA. This technique measures the density of bone. It focuses primarily on the lumbar vertebrae and hips. In practice, this procedure helps detect bone density loss before fractures happen. It's also helpful for assessing fracture risk and monitoring the effects of the treatment. Osteodensitometry is recommended for all women aged 65 and older, men aged 70 and older, anyone who has had a bone fracture after age of 50, and individuals with specific diseases or those taking medications that increase the risk of osteoporosis. A specialist, rheumatologist, or endocrinologist manages the treatment of osteoporosis. The doctor will collect data about symptoms, risk factors, associated conditions, and medications. Before the examination, it is important to know the names and dosages of any medications being taken. So, bringing a list of medications, or even better, their containers, is advisable. Laboratory tests may include blood counts, calcium levels in blood and urine, liver and kidney function tests, and vitamin D levels. If an individual has experienced a height loss of more than 4 centimeters or 1.6 inches, an X-ray of the lumbar spine is typically performed to check for vertebral fractures. Treatment involves addressing bone fractures and managing the underlying condition. Hip and lumbar vertebral fractures are common. Hip fractures usually require surgical intervention, such as installing wedges, plates, or hip prostheses. Following surgery, intensive rehabilitation is necessary to restore the individual's pre-injury function level. Vertebral fractures are generally managed without surgery, focusing instead on pain relief therapy. Managing the underlying disease involves identifying and mitigating risk factors associated with bone loss, ensuring adequate intake of calcium and vitamin D, maintaining regular physical activity, and using appropriate medications. The decision to administer specific medication is based on the estimated fracture risk. If the risk is low, only general preventive measures are recommended. However, if the risk is high, medications may be prescribed. Numerous drugs are available for treating osteoporosis, including estrogen replacement therapy, bisphosphonate, and various monoclonal antibodies. Finally, preventive measures can be taken to reduce the risk of osteoporosis. A nutritious diet rich in calcium and protein is essential. Foods high in calcium include dairy products, meat and fish, particularly sardines with bones. Vitamin D is crucial for absorption of calcium from food and positively influences bone density in other ways. Although a small amount of vitamin D is produced in the skin through sun exposure, this is often insufficient, so dietary sources such as liver and fish are important. Many elderly individuals have low vitamin D levels, making supplementation necessary. Physical activity also positively impacts bone health. The best effects are achieved when sufficient physical activity starts at a young age and is continued throughout life. Weight-bearing exercises such as running, climbing stairs, and lifting weights are particularly beneficial for bone health. If you like this video, you can check another one about many important functions of calcium. Thank you for watching this video and have a nice day.